This conference will now be recorded.
Hello and welcome everybody to this latest edition of the ACRM Pandemic Webinar Series. Today's topic will be helping individuals with spinal cord injury, traumatic brain injury, and burn injury stay healthy during the COVID-19 pandemic. I'm John Morris and I will be your moderator for today's webinar. And I'm pleased to welcome our guest presenter, Xinsheng Cindy Kai from the American Institutes for Research and the Model Systems Knowledge Translation Center. Xinsheng Cindy Kai is a principal researcher at the American Institutes for Research. Dr. Kai has extensive experience in applying advanced research methodology and statistics in designing, conducting, and managing complex tasks and projects in large-scale, multi-site evaluations, meta-analysis, and knowledge translation. An expert in knowledge translation, KT, Dr. Kai is the co-chair of the Knowledge Translation and Implementation Coordinating Group of Campbell Collaboration. She directs the Model Systems Knowledge Translation Center, providing management, oversight, and intellectual leadership on all aspects of research, development, dissemination, and utilization tasks. Dr. Kai was the principal investigator of two sub-grants funded by the Centers for Disease Control and Prevention to study policymakers' needs for traumatic brain injury data and to develop the policy fact sheet for the long-term effects of moderate to severe TBI. And she was also a co-principal investigator of a KT grant to translate wheelchair safe transfer techniques to consumers and clinicians. Welcome, Dr. Kai. Cindy.
Thanks so much. Really appreciate this opportunity to share the free research-based resources that can help individuals living with SCI, TBI, and burn injury stay healthy during the COVID-19 pandemic. So, the disclosures. So the contents of this presentation were developed under a grant from the National Institute on Disability, Independent Living, and Rehabilitation Research, NIDLR. So NIDLR is a center within the Administration for Community Living, Department of Health and Human Services. So the contents of this presentation do not necessarily represent the policies of NIDLR, ACL, HHS, and you should not assume endorsement by the federal government. So there are three learning objectives. The first one is to use the free research-based resources developed by the Model Systems Knowledge Translation Center, MSKTC, to help individuals living with spinal cord injury, SCI, traumatic brain injury, TBI, and burn injury to stay healthy during the COVID-19 pandemic. The second learning objective is to understand how the MSKTC has worked with the model system researchers to apply a knowledge translation framework to make these resources useful to the end users. So you know why we recommend these resources for you to use with your patients and their families. And the third learning objective is to understand the principles in effectively communicating health information to support individuals with SCI, TBI, and burn. So in this session, I will begin by telling you a little bit about what Model System Knowledge Translation Center is about, and then we'll share with you the example MSKTC resources that can help individuals with SCI, TBI, and burn to stay healthy during the COVID-19 pandemic. And then I'm going to share with you the KT strategies to communicate health information and to ensure high quality and usefulness of the MSKTC resources. And I'm going to give you a little tour of the MSKTC website. And now we're going to open for questions. So first, MSKTC, it can be a mouthful if you're not quite familiar with what this Model System Knowledge Translation Center is. So MSKTC is funded by NIDLR. And the mission of MSKTC is to provide knowledge translation support to the model system centers programs. So you may wonder what the model system center programs are. Model system center programs are funded by NIDLR as well. So model system centers provide a multidisciplinary system of rehabilitation care. And this can range from emergency services through rehabilitation and re-entry into full community living. There are currently 14 spinal cord injury model system centers in the United States with 1 data center, and there's 16 TBI model system centers and 4 burn model systems centers. So each model system center program has a national data statistical center to support the data collection analysis. Okay. So the goals of MSKTC are to enhance the relevance and visibility of model system research and also to communicate the model system research effectively to stakeholders. So we have 4 groups of stakeholders. One stakeholder group is individuals with SCI, TBI, and burn and their families. And we also serve practitioners or clinicians, and policymakers and advocacy organizations also use our resources, and researchers, another stakeholder we serve. Here's our vibrant MSKTC website. We have over 1 million people coming to the MSKTC website from all over the world. So now I'm going to share with you some example MSKTC resources that can help stay healthy during the COVID-19 pandemic. And first, this slide shows the example SDI Resources that can help people with SCI to stay healthy during the pandemic. So you should see some of the topics we have, like bladder management, bowel management, safe transfer techniques, and now here, respiratory health and SCI, this is very important one. And also, you know, people's SCI at home can stay healthy, you know, through exercise and some fitness exercise activities. And the pressure sore and skincare, this is our top downloaded resource. And it's quite important for people SCI to continue to practice pressure sore relief. So the next slide. I'm sorry, my computer, there's a pause here. Apologize. There's some challenges with technology, I apologize. It's still COVID-19 effect, I guess. The computer just, without your permission, will start downloading things. Okay, here we go. Current slide. Here's the TBI resources that can help stay healthy during the pandemic. Alcohol use is, and TBI, these are the #1 downloaded resources. And, you know, people with TBI may experience headaches, you know, then our resource can show, you know, how you can manage. Here are some examples of burn resources to help stay healthy during the pandemic. Healthy eating is important. Itchy skin, they still need to manage itchy skin during the pandemic at home. And, you know, sleep problems, scar management, and psychological distress, pain, some protection if they go out to do some exercise or, you know, be exposed to the sun, they need to protect themselves from injury. So here's some links to the our MSQC COVID-19 resources. We have a web page. We even have a logo right here, MSQC logo with COVID-19. Our theme is stay healthy. Later on, I'm going to give you a tour, and I'm going to show you all these resources on the website. So we have different types of MSKTC resources can help individuals stay healthy. We have fact sheets, slideshows, and hot topic modules, videos. So I'm going to show you these as examples. Here, the slide shows fact sheets in English and Spanish in 3 injury area. And we have infocomics. The infocomics are basic graphic presentation of information in our fact sheets. And the infocomics are also in English and Spanish. We have those fabulous slideshows, and that they're narrated, how beautiful they are. It's not, some of the individuals, they love to hear the, people just walking through them of different steps of doing things. So these narrative slideshows are just fabulous. You can turn them on and then to watch a nice slideshow. And we have video products, and our video products are award-winning. We got 3 Tele awards now. They're outstanding, therefore outstanding online education resources. Here's an example of TBI video, short video. And here's an example of how to do a shoulder exercise for people. It's also a little short video. We package all of the resources, for example, fact sheets, videos, and slideshows in a hot topic module on a specific topic. This is the exercise after burn injury hot topic module. In addition to the consumer resources, we also have other free research-based resources, for example, facts and figures, model system database information. There are systematic reviews. We also have a toolkit with knowledge translation tools. Okay, so after showing you some example resources we have, I'm going to show you why we would love for you to use those resources, because they're truly high quality. We'd like to show you how we have applied a knowledge translation framework to communicate and develop health information products. And so first, the knowledge translation. For some of you, you probably already know what knowledge translation is. And here's a definition of from the Canadian Institutes of Health Research, because knowledge translation was coined first by the Canadians. According to their definition, knowledge translations is the exchange, synthesis, and ethical sound application of knowledge. And this process is within a complex system of interactions among researchers and users to accelerate the capture of the benefits of research. This is kind of hard to understand, in my opinion. So we further explained it. We put into plain language and translated for you their definition. So for the knowledge translation, for MSKTC, knowledge translation is to engage stakeholders throughout the research and development processes, from planning to executing to follow-up. So the goal is to promote findings that are meaningful, relevant, understandable, and accessible. So this is our MSKTC approach, a KT approach. There are several steps when we apply the knowledge translation in developing our resources and communicating the health information. The first step is to understand consumer needs through KT research. So we have been doing the consumer needs assessment every year. So here are some questions that we have on our consumer needs survey. We ask them what some of the topics that they like to learn more information about. And then we also ask them, how would you like to receive information? And what kind of a format should we package the information for you? So we use the consumer needs assessment to identify topics and decide the formats of our materials. So that's step one. And the next step, when you develop any health information resource or communicate health information, you need to really understand, what the purpose, why patients need to have information products. Typically, based on our experience, patient and the family members wanted to know, to understand what is happening to my body right now and what is causing it to happen, and to understand my body, and also to understand in medical terms that that they can use to communicate effectively with doctors and clinicians. And they also wanted to know the options that are available to them, with some pros and cons. So we need to really establish a clear purpose when we communicate with patients and families, really meet their needs. So when we develop any health information products, the readers, they need to be able to easily identify what the purpose is and what they can do with the information. So that leads to the next step. It's empower and support decision making. So in all our materials that we have developed, we always include information to help readers make decisions and take actions, because that's critical. We include action-oriented sentences and phrases whenever possible, and we present in action in terms of actions could be taken by the patients, but family members or clinician to address their medical needs or medical condition. So we highly recommend that when we write a fact sheet, we should not be focusing too much on the their conditions, but rather to share with them what they can do about it and some of the steps taken to manage the effect and reduce its impact. So here's for most audience, this rule truly applies. Never tell something that I can not do anything about. So this is about empowering our patients. So the next thing that is critical when you're applying knowledge translation to communicate with patients and family members is that you need to think about managing emotional impact. And also, this is also true. I have this little sticky here in pink because it's quite critical and hope to draw attention. Typically, patients and family members do not view information objectively, but through an emotional lens. So when we talk with patients and family members, when we do our consumer testing of our products, I'm going to talk you to consumer testing in a later stage, that sometimes that patients, families will start crying. And we had to really reschedule the testing session with them, because some of the information does invoke some emotional reactions from our readers. So we need to have strategies to manage the emotional impact. So here's some of the strategies. So be aware of potential emotional reactions. That's number one. And that means to the amount or nature of information that may affect motivation to continue reading this fact sheet, or just taking an advice from you in this information product. And also we need to recognize and limit worry producing content, and sometimes we just scare them and they would do it. Actually, that's not true in many cases. And we also need to present information in a way that increases patient and family member self-efficacy. So when we present some information that it may be outside, some outcomes that may be outside their control,
we need to get her to do.
It is. It's very hard to do. And so we do need to include some positive coping approaches to make sure they know they can do something with it. It's now don't think they're worried about it. They're empower them, and that's our goal. So some of the strategies we use about strategize around emotional impact. So use qualifiers for most people, or sometimes, because when we communicate with patients sometimes, and they will say that, is that true? Is this going to happen to me? Is this everybody's going to have this negative outcome? So we want to be really careful when we communicate information like that. So in general, avoid scare tactics because they're not quite helpful. They're not useful. and they produce a lot of anxiety in our patients. And also we want to avoid, when we have unavoidable negative information, then we should consider have it be tempered, positive coping, and encouraging statements. So we need to temper our unavoidable negative information with positive coping and encouraging statement. And here's some examples of strategize around the emotional impact. And also on the green sticky, if there's some functional loss or negative outcome, when you present it, probably say that this can be embarrassing or making you feel isolated. However, many people have found ways to overcome these feelings. Yes, you present this negative outcome here, but then also to encourage them. Many people have found ways. They need hope. And on this blue sticky, here's another example. So thinking about possibilities can be frightening. Yes, it could be frightening. However, being aware of possible problems give you the chance of avoiding them or act quickly to reduce their impact. That means that you can do something about it. So this is also another example of empowering, help our patients with, encourage them, give them hope that they can do something. Also, and I think that may be fun to give you some true and false quizzes. I cannot see your faces, I cannot hear your voice, and if you want to put in chat box, that should be fine. The first one is writing in plain language is the federal law. Is that true or false? And the second one is the plain language is watering down or dumbing down. True or false? And the third one is the plain language. It's all about how many words that writers use and how difficult the words are for readers to understand. So there are three statements, true and false. So the first one actually is true. So there's a Plain Language Act of 2010 makes writing in plain language the law. So it is a law. And that requires the federal agencies to communicate in plain language so that citizens can understand the information and services provided to them. So plain language is actually it's not about watering down. It's not all about words or sentences. And so plain language writing focuses on helping readers quickly find what they need. When they find what they need to understand what they read. And after they finish reading what they read, they can act appropriately on what they understand. So there's some general guidelines when you write in plain language, especially when we communicate health information. Now, the first one is to use medical terminology sparingly, only to assist patients in clinical settings. So lots of people say, well, no, medical terms are long. That does include, medical terms can increase the reading level. However, then we cannot just eliminate all of them. If they don't read from our resources, then they will hear from their clinicians or doctors and other healthcare providers. So we need to educate our patients. So we typically define and explain the physiology or the complex context and using plain language. So we do include the medical terminology. We sometimes include the pronunciation of it and have a brief definition of it. So the second one is that for some of the complex concepts, we can include images or pictures to explain, to help people understand. And we also try to use everyday words in place of technical jargons. And we always avoid, when possible, some of the term analogies and metaphors that only, apply to certain ethnic groups and gender groups. And so we might want to make sure the language we use would actually be able to appropriate across the generations and gender groups and ethnic groups. So the last point here, to use simple sentences in present tense when possible. Yes, we don't want to use long sentences, and passive tense tend to really make it difficult for people to understand. So another strategy that within the knowledge translation framework, it is when you communicate health information, especially in writing, we need to have a clear organization. So people need to know what is the topic, what is the takeaway, and what do the words mean, and what questions does this answer, where can I learn more, what does this information come from. So this is basically the layout of our fact sheets. This clear organization is really helpful for our patients. And also that we mentioned early on that, for some of the, the plain language writing strategy, that we want to use images and pictures to enhance comprehension, especially some of the difficult concepts. So here's some of the principles if we want to use images. So some of the anatomical diagrams should show where the anatomy is, especially within the body. So I'm going to show the example later on, which is the right way to do it and not right way to do it. And also, it's, some of the diagrams should be easy to read, understand, and need to have labels clearly on the diagram if you want to use it. And the image should be concrete, not conceptual, and so people clearly see what you're trying to present. And also we try to avoid using photos that invoking negative emotional reactions. And this again, coming back to the emotional lens that our readers are typically use when they read any information materials. So I'm showing you some examples right here. Here's the effective and ineffective graphics. And so you see on the left-hand side, here's a diagram. So can you tell me where this anatomy is located if you're not quite familiar from a layperson perspective? So we do have labels on it. The kidney will show what the kidney is, what kidneys are. However, it doesn't show you, the physical context. So the graph on the right-hand side is a better one because it has some physical context around it. Okay. All right. So when we finish writing the materials, then we need to think about, can people really understand? We have talked about, we need to have a clear purpose. We need to, provide actionable recommendations. And we need to manage an emotions to make sure that patients will not stop reading it because that invoked negative and strong emotions when they read our materials. And we try to use plain language writing to make sure that we present information in a clear way that is really following the plain language writing principle. We don't stop there. So we need to make we need to make sure that what we have developed that really accomplish the communication goals we set for ourselves. So our next step is to conduct consumer testing. In the consumer testing of our products, we typically include 5 to 7 people. Then we use this as a saturation rule. So when we feel like we gathered all the important information from them, then we'll say, okay, so the testing is satisfying. If we feel like people still disagreeing about certain things, then we need to recruit more participants. So the goal of the consumer testing is to make sure that patients understand our resources. So for each consumer testing, we always develop a protocol. the protocol layouts, the purpose of it, and the steps of it, and detailed question of it. So for the consumer testing, we all want to have a clear purpose. Do the resources help make patient decision easier? If like patients could not understand, then it is hard for them to really make any decisions. So we want to assess comprehension. We typically ask them whether they understand certain things, ask them to define in their own term, in their own way, in their own language, in their own words about certain medical terms. And we also want to confirm the resource that we develop are truly useful for them. And we also want to make sure this emotional part, because I mentioned early on that when we test our resources, some people really crying. So we wanted to make sure that we manage our information in a way that minimizes some negative emotional reactions. And I also want to make sure that our resources are respectful. We want to make sure our resources that culturally sensitive. And so some of the terms that we asked in our protocol questions, we asked them about, can you understand the resources? And we also ask, and is this offensive in any way? So then we get their feedback, and then we use their feedback to improve our products. Then we go back with the authors, summarize the recommendations from our consumers. Then we say, here are the things that consumer would like to you to make changes, and then authors will make those changes. And we don't stop there. After we're testing the resources and make revisions, and we have another layer of and very critical quality control. This is quality assurance to make sure that that information that we produce not only user-friendly but also accurate. So as I mentioned early on, that model systems, we work very closely with model system researchers to review, develop, and also have them to review and approve our resources. The model system project directors review and vote on all of the fact sheets and before we publish them. And on the fact sheet, we have a statement, and to show that these fact sheets and our health information here, health information content is based on research evidence. It is when available and represent a consensus expert opinions of the model system project directors. And it's also this is a statement of TBI model system, and here's another one, the source, the SCI model system fact sheets. So that basically show that these resources are high quality based on project directors and experts consensus. Okay, so when we have finished our writing of the English fact sheets and approved by the project directors, we translate them into Spanish. And we are actually in the process of developing a Spanish home landing page for our Spanish resources on the MSKTC website. So we do have all the fact sheets and info comics in Spanish, both in English and Spanish. And we don't stop there either. We continue to ask our readers and our stakeholders to provide feedback so that we can improve our work. So on our website, we have fact sheet feedback and user feedback section. So we do look at them and then to really continue to use the information to improve our materials. Okay. So you have learned about what resources available could help individuals with SCI, TBI, and burn to stay healthy during the pandemic. And you also learned the rigorous knowledge translation process that we have used to develop those resources to ensure that they are high quality and user-friendly. So now I'd like to really ask you to become an ambassador for us. So how to do this? I would really encourage you to use the MSKTC resources in your practice and to share these resources with patients and family members. And also, I know some of you that use social media and other channels, that you can really share our resources with your networks. And to make it easier, MSKTC has developed media toolkits with sample newsletter messages or social media postings and outreach email templates. So if you need it, please let us know. So I have a few minutes, and I think I'm going to show you the website, give you a little tour of the website. So I'm going to exit the mode of the website. So at PowerPoint, so I'm going to go to the website. This is MSKTC website. Actually, when you first log on to this, you see this pandemic. So click on it, you can get to the resources I just presented today. The example resources can help people stay healthy in the pandemic. And so the MSKTC website is organized by injury area. So we serve individuals living with SCI, TBI, and burn. So under each injury area, you could see the different types of resources we have. And so I have this one is living with spinal cord injury. When you click on any of the topics, then that will show all the resources that we have. For example, this is managing pain. After SCI, we have a fact sheet, we have a hot topic module. These are the videos we have, and we also have narrative slideshows. These are the videos, all the video clips we have on this topic. And this will be the same for TBI and burn. It's the same. So for TBI, these are the resources that I shared with you today of the consumer resources, and also we have quick reviews. These are the plain language summaries of the publications by the model system researchers. And we also have research database. For TBI model system, we have close over 1,000 research publications by the TBI model system researchers. And we also have systematic reviews. And if you want to know, which, where the model system center is located, you can click on this part, TBI model system, and external resources. So I am going to also show you here's the page of pandemic, the resources we have to stay healthy during the pandemic. And we also developed those flyers that to summarize the resources that are relevant to a pandemic. This one is the burn injury one, and these are the example TBI resources to help stay healthy during the COVID-19 pandemic, the fact sheets, the info comics and the slideshows, etc. And this one is the SCI one. We also have if you click, go to our website, you can also see we have, if you want to learn more about model systems and, what model system programs are, wanted to, look at their databases. And we also have resources about the databases, how to access databases for your research. We also have a fabulous knowledge translation toolkit, which is on our website, and with many wonderful tools can support your knowledge translation effort. So I'm going to go back to the slide mode. Oh, I apologize. I think I'm closing my portion of the presentation. I think we can open up for questions.
Okay, great job, Dr. Kai. Thanks so much for sharing your expertise and all the interesting and fascinating things happening at the Model Systems Knowledge Translation Center. We do have one question from the attendees, from Sue Sisto. about the consumer assessment. Can we, I guess the audience and other researchers and people in the rehab community, access the consumer assessment survey data that you have collected annually? And
Well,
how?
oh yeah. So you like to access the survey data, right?
I would, and I think Dr. Sisto would as well.
Yeah,
And
contact
also
me.
the questionnaire too, I suppose.
Yeah, we'll be happy to share the questionnaire with you and the results. So send your email me. You can email me. I have my contact information at the end of the slide. And I apologize, I have to navigate through the slideshows. The computer is not cooperating today. I wonder that got coronavirus. So you can email me. I'll be happy to share that information with you.
Okay, fantastic. Thanks so much. And then I've had a follow-up question to that question, which is then, when was the most recent consumer assessment completed? Was it before the pandemic? And basically I had a series of questions about, well, how has the pandemic changed the work of the Model Systems Knowledge Translation Center in terms of gauging consumer needs and deciding, both in terms of content, but also in terms of mode of delivery? Is it, are you guys continuing according to the way you've been operating, or is there a sense that you need to somehow engage the new needs on the part of your stakeholders?
Such a fabulous question. Thanks so much, John. I would say that the mission of the Model System Knowledge Translation Center is to serve our stakeholders, use the best available technology, methodology that available. So we involve consumers from the beginning to the end of the work we do. So consumer needs assessment is what guides us in terms of developing the resources. So nobody expected this pandemic would happen. It's definitely something in caught us off guard, all of us. And so MSKTC trying to be responsive. So we have developed this strategic outreach for COVID-19, and we look at our resources, some of the resources that we could use to help our patients and families right away. And for example, safe transfer technique. Those resources, the core content will not change, because that's how you perform safe transfer technique at home, or if you go to the hospital or other places, it's the same. And some of the other content, I would say definitely would need to be revisited in the context of COVID-19. And then we'll definitely need to work with the researchers, models and researchers do that. So we will, to answer your question about when we did our last consumer needs assessment, actually our consumer needs assessments are ongoing. We have an active link on our website, and we also have been working with our partners to disseminate that the link. And so we have the most data we collected actually before COVID-19 happened. So we will continue to collect data, and we will continue to reach out to our consumers and to see, what kind of contents that they would think would be helpful, and how they would like for us to package the content, and how would they like for us to deliver the content to them. So that would be guided by the consumer needs research, and also we'll be working very closely with the model system researchers to do.
Super, thanks so much. And then when you in this ongoing sort of engagement with consumers, do the model systems partners and the MSKTC, are you specifically including new questioning or new lines of inquiry related to additional or different needs resulting from the pandemic and social isolation and all of that?
Absolutely, we do need to revisit our the needs assessment. And I think there might be several steps that we could do. Of course, this is just my thinking of it, and I need to work very closely with the Model System Knowledge Translation Committee. So I would just say that we definitely need to revisit our surveys, add some questions to it to understand the needs of our stakeholders during the pandemic. And then also we need to really review our content and to see whether we need, what kind of updates we need to make. So for all our fact sheets, we try to update them to ensure that the information is current. So this would be true, especially for our resources when we look at those resources from the lens of the COVID-19 pandemic.
Super. So, and another question then, the fact sheets include topics for the different stakeholder groups on things like healthy eating, sleep, managing stress. And in the current environment, those seem like universal sort of needs and informational needs. Is there a thought that maybe, I know this might be a little far afield, but to produce fact sheets or other informational products that might sort of span all three of the stakeholder groups, the TBI, SCI, and burn injury?
Yes, that's such a good question. So we do have some, we develop those resources based on the top, the priority that the topics that consumers say they would like to have more information. That we do our needs assessment by injury area. And you see some of the common themes across the injury area. For example, depression. We have depression fact sheets across the 3 injury areas. And also have pain management is pretty also, helpful for all those 3 injury areas. And we're also in the process actually developing a clinician, a series of clinician fact sheet, one for each injury area about how to provide guidance about how to, opiate use for our patients. Definitely, that's a really good idea. And we need to, especially given this pandemic, we need to visit our resources to identify those common, areas and see whether which injury area does not have the resources. And then we'll work with our models and researchers to develop.
Super. And about the emotional impact of the materials, there was very compelling information about sort of being sensitive to the situation of your stakeholders. And I'm wondering then again, in the current environment, if there's any need or perceived, need to be extra communicative, if you will, of being sensitive to the emotional needs of the various stakeholders.
Well, absolutely. That is such a good question. So the emotional lens, and then it is such a sensitive, very sensitive topic, especially in this pandemic. And I would just say that's, absolutely is very true. When we communicate with our patients, with our, individuals with CI, TBI, and burn and their families, they may face actual challenges than people without these injuries. And we need to understand what some of the challenges they are facing and be sensitive of the emotional reactions we may encounter when we interact with them. Definitely, that's something we do need to consider in our product development as well as in communicating with them.
Great. Well, and I have one last question, and it's really a general question. The info comics really grabbed my attention about, this sort of effort, presumably to address health literacy needs of your stakeholders. And I'm just wondering where that idea came from, and if you could quickly, in the few minutes remaining, tell us how that originated and what the process was like in developing those.
Great, thank you for that question. Yes, actually, it's one of our popular products. Now, first, that when we had this infocomics, we thought, you know what, they are maybe the young adults and youth will love them, and then we were at conferences exhibiting those infocomics, and we found that, you know, people from all ages come into our booth will grab them first. So we are just quite excited about it. And infocomics definitely is such a great way to communicate information. So they are based on the fact sheets. And we currently have the infocomics on TBI, and we're in the process of developing SCI infocomics and the Burn infocomics. They are all based on the fact sheets. And so this is definitely a graphic format, because now people learn things differently, and we all have prefer different modality. Some people just really love reading the fact sheets and love the print materials. So actually the infocomics is just one way of our effort to communicate in many different formats. You know, package our information in many different formats to meet the needs of our end users. So, and now some people love the images, and so we have the infocomics. And also some people just love reading the fact sheet. They have the fact sheet, and some people love to listen. So we have those narrative slideshows, and some people are even more visual. They like to see the, you know, the screen, you know, the step-by-step processes. So we have those videos. So I would say that is one effort that that we translate our medical information to make it as user-friendly as possible for end users. And we do have plans to develop other products. Then, for example, that we have those we call it podcast briefs. Then that people can just listen to the podcast briefs on our website, and we constantly develop, you know, trying to be on the cutting edge, trying to be innovative to better meet the needs of our end users.
Excellent, excellent. Thanks so much, Dr. Kai, for this wonderful presentation and great discussion. I see that there are no more questions from the audience, and so with that, we will close. Thanks to everybody for attending, and know that the recordings from this webinar will be accessible via the ACRM.org website within 24 hours. And then please do share this with your friends and colleagues as well. So thanks again, Dr. Kai. Cindy, it was really a great pleasure to have you participate in our webinar series, and have a good day.
Thank you.